Welcome to Your Healthcare Matters. I'm your host, Jenna Sims, and I've worked in healthcare for over a decade. And like many of us, I'm really concerned about the deterioration of our healthcare system. On this podcast, we interview patients, healthcare professionals, and advocates to provide unique perspectives and helpful tips for navigating our failing healthcare system. My goal is to inform, connect, and inspire listeners to take your health into your own hands. My guest today is Dr. Darren Joneson. He finished his medical residency in Chilliwack in 2017. He then opened Spectrum Medical in 2020. He wears many hats and is currently the medical director of the Chilliwack Youth Health Centre, a hospitalist, and he's a long-term care physician. He's very passionate about team-based care, mental health care, and advocacy. Welcome, Dr. Joneson. Thank you so much for joining us today.
Thanks for having me.
So we'll dive right in. So my understanding is that you didn't go straight into medical school. Can you share with us a little bit about your work experience in other fields and how that's contributed to your worldview as a physician?
I grew up in Chilliwack doing the usual jobs that high school students do here. After high school, I was a missionary for a couple of years in Madagascar. That's really where I decided I wanted to become a physician. And I wasn't one of those high school students that would have been voted most likely to become a doctor. Let's just put it that way. And so after that, university, did sales, selling cell phones, cameras, lawn care, basically stuff that's not like super essential, but people bought it up. So now I sell stuff that is incredibly essential. And my audience, I guess you could say, is a little bit more challenging sometimes and a little bit more receptive at others.
Right.
And so that's kind of what's led me to here. And I've always just enjoyed interacting with people. And that's probably the best part about being a family doctor is that you get to have those relationships with people over a long period of time so that you can get to know them and understand them.
So it looks like you work in several different locations. So do you have a desire to just be involved in several different types of care?
Yeah, I think variety is the spice of life. I have a fairly short attention span, and so being able to do a lot of different things is what keeps me going day to day.
So with your history in business and sales, I'm really curious to hear your perspective about the current medical economics in BC and how that impacts healthcare delivery.
So that's a great question. I have a psychology background, so I did my undergrad in psychology and specifically had an interest in things like behaviorism. And also working in many sales fields, saw how different organizations and companies used money as a way to shape the behavior that they wanted in their employees. And so for me, I think about the healthcare system from that sort of psychological lens that really the things that are important to our communities, to our patients, those are the things that need to be incentivized. And it's not necessarily up to physicians or politicians to decide what that is. That's up for the communities to kind of say, look, we need more mental health supports, or look, we're really struggling with surgery wait times, or whatever that is. People are going to go where they're valued. And so that's, in my opinion, how the system needs to be set up.
Mm-hmm. And can you give me an example of a situation where you don't feel like the reimbursements are sort of in line with what the community needs?
The previous fee-for-service system, I mean, it's still there, and there's still many physicians who utilize that. It often is a bit of an a la carte approach in that the physicians bill for the services that they provide. And often what is not accounted for in that model is the time spent on those services. And so, for example, you could have a patient that is in for less than a minute. They want a refill. It's very straightforward. You're going to bill the same amount of money for that patient as the one that you do a complete history and in-depth assessment and treatment plan, and you spend time connecting and explaining and educating. You're going to get paid the same. And so you're going to have times where the system is pushing you to be quicker than you want to be. Because most physicians that I know, they want to spend that time. They want to be able to engage and to actually maybe fix some problems or at least provide some solutions. And we can't do that in 10 seconds. And at the same time, we also can't afford to take an hour with every patient. And so it's kind of that finding that in between is the challenge. The new LFP payment model, it does help a bit with that, in that there is kind of a background hourly rate, and there still is a per visit rate, but it doesn't feel as stressful of like, okay, I've got to pay my overhead, I've got to pay my staff, I've got to pay the bills, so I got to see this many people in order to do that. It's more of like, okay, we can book longer appointments if we need to, and we can do these sorts of things, and we can spend the time that's needed. And so that's really great.
Can you describe for our listeners just what the LFP program is briefly, just so they can understand how that's changed things for you?
Sure. So again, just back to the fee-for-service model, historically is what physicians have used for decades. And, essentially in that model, again, you bill for what you do, no matter how long that takes. And there are some specialties, for example, that the procedures they did used to take 45 minutes. And so that fee code was allocated for that. And now there's technological advances and they can do that in 10 minutes, but the fee code's the same. And so they're getting paid a lot more for a lot less time. And there are other things where it's more time consuming. I'm boring myself right now. Give me a second. Okay. So, fee for service, like I mentioned, that is, billing a la carte essentially. And what LFP does is it provides a bit of an hourly backbone. One of the biggest challenges that physicians face is just the amount of administrative and unpaid work they were doing, right? And so all of the labs, all of the consult reports, all of the imaging, all of those things take time. And the physicians who open their practices because they are wanting to help more people inevitably have more paperwork and more work to do that way that prior to the LFP model was unpaid work. And so one of the benefits of the LFP model is that it's provided that compensation for what previously was just volunteer work, essentially. The other thing that it does is for clinical work, when we're interacting with patients, is it provides, again, that backbone, baseline compensation, so that if we take a little bit more time or we want to book longer appointments, it's not cost prohibitive. And it has been enormously successful in terms of the amount of physicians who have transferred over to that model. And so, I haven't yet. That's just more due to the complexity of the practice that I have. Mm-hmm. But certainly it's a huge step forward, probably one of the biggest steps forward for family doctors in Canada. And BC is leading the way. We're seeing a lot of things like this now going to some of the other provinces. So it's very, very exciting.
Right. That's really encouraging to hear.
Yeah.
So it sounds like that has addressed a lot of issues regarding payment for physicians. Do you have any suggestions for other improvements you'd like to see in the system?
Sure. So a couple of years ago, every day in the news was something about this clinic's closing or that clinic's closing. And we talked a lot about the crisis in primary care, which has not gone away. This has helped a bit with that primary care crisis, but now what we're seeing is a bit of an acute care crisis because, there's been a bit of a migration of physicians who, previously maybe were more focused on acute care, now are doing more primary care. We have a lot of physicians that have retired who, especially during the pandemic, it just wasn't feasible for them to be in the hospital, being at risk, exposed to COVID, etc. And so what I think we're kind of missing here is a bit of the incentivization of breadth of practice. So, not only do we want family doctors accepting patients and providing that primary care, but we want them to see their own patients in the hospital if they can. We want them to see their own patients in long-term care. If they are physicians that do that kind of broad, full scope of practice, they really should be rewarded for that. We've got physicians who deliver babies and are on call all throughout the night and still go to their clinic the next day. And it's one of those things that if we just keep changing the numbers for this one and that one, then we'll still see those like slow migrations of people going to where they're valued the most. But if we can value doing more in terms of scope, then I think we may see that there are some solutions or I think we'll see more benefits for patients. So you had talked about kind of ways to improve the system.
Mm-hmm.
And so, those like stress toys that when you squeeze them, they like go away from you.
Mm-hmm.
Sometimes it feels like that's what we're doing in the healthcare system, is that we're squishing to like solve that problem, and then it just goes somewhere else.
Right.
And I just feel like what we're missing is a cohesive, long-term vision.
Mm-hmm.
We've known for decades that the baby boomers are aging, that long-term care is going to be in crisis. These are not difficult things to see in terms of trends and figuring out what's going to be happening. People are living longer. But there wasn't a whole lot of actual dollars and cents that went into planning and being ready for that. I think the mindset has been, we will cross that bridge when we get there. And then we get there and we forgot to build the bridge in the first place.
Right.
And so one of the things that I've noticed just in the different committees and things like that is it seems that especially politicians, they forget that family physicians are specialists in primary care. And with the whole rollout of UPCCs and those sorts of things, I think the intent of the government was really good. I think they understood the value of team-based care. They understood that people needed better access to primary care, but they missed the piece about family physicians being specialists in primary care. And so those clinics have in large been rolled out by health authorities. And in most situations have been largely unstaffed or more accurately understaffed. So what we really need is we need family doctors working in teams and guiding that care. And we need them to be respected and acknowledged for that expertise that they have. In Chilliwack here, a couple of years ago, we had the Evans Road clinic that was built. And I do apologize. It has a First Nations name that I can't pronounce that I really need to learn how to say. And it cost $5 million of taxpayer dollars. $5 million. I did the math at one point. I think it was something like $376 a square foot. And it's gorgeous. They've got some sacred space. It's beautiful. It's open. There's lots of clinic space. But in the process of building that, the health authority did not listen to physicians who were providing care to really vulnerable populations.
Mm-hmm.
And in so doing, that $5 million investment resulted in a loss of 5 doctors that were providing that care. My clinic is not as shiny, but it cost me.
So the ministry has been investing quite a bit in urgent primary care centers, and I'm just curious to hear, what has your local community's experience been with that here in Chilliwack?
We recently had the primary care center rebuilt on Evans Road. It has a beautiful First Nations name, unfortunately, that I can't pronounce, but it means helping hands or helping one another. And it cost $5 million for that center to be built. It's got sacred space. It's got clinic rooms. It has space for allied healthcare professionals to work. It's gorgeous. But it worked out to about $376 a square foot. And at the same time, I actually built my clinic, Spectrum Medical. It is by no means as shiny. It's not as grand. It's not as beautiful. But it cost me $27 a square foot.
Wow, that's significant.
So when you look at our healthcare crisis, it's not because there's not enough money. It's because the money is being allocated in such a way that first line healthcare workers are not seeing that benefit. And a lot of it's being swallowed up in health authority, redundant bureaucracy.
I think just to clarify, would you say that you'd like to see a little bit more stakeholder involvement from physicians when the ministry is consulting, when they're looking at opening these large multidisciplinary clinics?
I don't think consulting is what's needed. I think that the physicians who are involved need to have decision making power. And that was unclear for a long time when we were talking about the new clinic in Chilliwack. And so moving forward, we were trying to figure out, okay, like, yes, we're happy to be involved. We're happy to provide guidance, but I need to know, am I just giving you ideas? Do I have any actual ability to enact positive change here? And if not, then I think my time is probably going to be spent better elsewhere. But it's a matter of, as a population, we have to demand accountability from our elected officials. And, at the end of the day, we are going to choose who we want to make those decisions. And if we don't choose individuals who are, never mind. Well suited for the job. Yeah.
Okay, so we want to try to remain apolitical.
Yes.
So it's hard.
We need to finish ideas though, because I don't know if we can talk about all the people in Chilliwack. It trailed off. We don't have an ending to the idea. I want you to seem like you're not crazy.
Okay.
Right. So I'm just curious, would the end goal, instead of having UPCCs, this is just off recorded, instead of having UPCCs that are run by the ministry, would you rather sort of coalitions of physicians having their own private businesses for multidisciplinary care? So if you had a group of 4 doctors that started their own private practice and had a large facility that the ministry helped funded, but those 4 doctors still get to run that facility as if it were a private business. Do you feel like that would be more impactful than the way the UPCs are currently run?
I mean, if we look at a lot of current like health authority run things, hospitals being obviously the big one, there's a lot of physicians that worked there because the pay was better and the overhead was nothing.
Right.
Right. And so why we expect other physicians, and there are specialists that are included in this as well, to spend money out of their own pocket to fund the supplies, the staffing that happen, when they could just go somewhere, make more and pay less, they're going to go there. And so I think for primary care, it's important that the government is mindful, and there are some programs out there, in terms of being mindful of overhead costs. There certainly have been attempts to address these things. What hasn't happened with the rollout of the UPCCs is it really hasn't been physicians and physicians specifically calling the shots. And because of that, or at least in part because of that, they're having a hard time finding doctors to go and do the work.
Right.
So I know locally in Chilliwack, there are a lot of people at our health authority in leadership there that I have great respect for. I've sat in hours and hours of meetings with them, and they are kind, compassionate, passionate people that want to make a difference. And at the end of the day, they're functioning in the system that we're all in, and they're doing what they can within that system. But at some point in time, we can't just make marginal changes in how we do things. At some point in time, there needs to be radical change. And we haven't quite seen that. I think we want it, we hear about it, but we're not exactly sure what it looks like. And so who do we listen to? Who do we trust to provide us with the information that we need to make those decisions of what that radical change will look like? And that's what as a society we have to decide. Obviously I'm biased, so I'm going to say, oh well, family doctor should make that. Yeah, I believe that, and I think that I know enough family doctors and other physicians that are so passionate that would be huge. The health authorities have some great skill sets in terms of like rolling out things and the scaffolding and infrastructure of their bureaucracy. There are some safeties that builds. And I think there's got to be a way that we can take their strengths and we can take the strengths of family physicians as specialists in primary care and marry those together in a way that is transformational. And I think, I'll be honest, I'm hopeful. I think we're getting somewhere. It was a battle, but I feel like that, people are listening. Politicians are listening. People are now realizing the importance of having access to a family doctor. So, yeah.
Well, I'm glad to hear that you're hopeful. So just to recap, sort of my thoughts of what I've heard you say is that you feel like everyone has good intentions, but potentially there could be room for some improvement on how to collaborate and move forward in a new direction that's going to help serve communities better. Would that be accurate?
I think so. I think if we were to use an analogy of the payment system, just as an analogy of the overall healthcare system, the fee-for-service system has hundreds and hundreds and hundreds of different fee codes, and you got to be able to do this, and it's very, very, very complex. And the LFP, the new model for family doctors, it has far fewer fee codes. It's much more of a simple model, and so I think the health authorities, they need some simplification. They've really they're very dense right now, and I think there's something there that we can simplify, that we can break down silos, so that there's not hundreds of people doing the exact same job trying to figure it out from scratch.
Right. So sort of removing some of those redundancies and having a bit more strategic planning then.
Yeah, and that's health authorities. That's even in just physician advocacy groups. It took me so many years as a family doctor to figure out what family doctor group is doing this for me and what family doctor group is doing that. I've got the Division of Family Practice. I've got, the BC Family Doctors. I've got the College of Family Physicians. I've got the Family Practice Service Committee. And I'm just like, who is doing what, And is there a way that we can simplify?
Right. Well, we're happy to have you as part of BC Healthcare Matters.
Yes.
Thank you for joining another group. So I just like to change direction a little bit. I think sometimes listeners forget that doctors need doctors and that doctors are patients as well.
Yeah.
So I'm just wondering if you could share some of your experiences with being a patient here in BC and some of your journeys.
Yeah, absolutely. I mean, there are many doctors that I've spoken with that have even had trouble finding a family doctor. I'm lucky. I have a family doctor. I think she is fantastic. She's been my doctor since I was a resident here. And so there certainly is some privilege that I've had as a healthcare professional in having access to her. There's certainly privilege in, I think it's important to just kind of acknowledge that, right? That there is privilege and knowing how to navigate the system. And so myself personally, almost 3 years ago now, I was diagnosed with hairy cell leukemia.
Oh, wow.
So I was working one day in a long-term care facility, and I just felt quite unwell. And one of the nurses at the station just took my blood sugar and it was crazy low. And I thought, you know what, I could be healthier. I've got a family history of diabetes. And so I went to my doctor and I said, hey, can I get some blood work? And the fact that I could schedule that and go to my doctor, first of all, huge benefit. If I had to go to a walk-in clinic, I'd probably been like, it's probably not that bad. I'll be fine,
Right, yeah.
Anyways, long story short, she called me and said, look, you've got cancer. And, I've told lots of people that news. I've had to tell them that they have cancer, and my heart always goes out to them. It's always it's a scary thing. It's a scary thing to go through and not know. And, hairy cell leukemia, I didn't even really know what that was. And that's after all of my medical training. When she said, you've got hairy cell leukemia, I'm like, am I dying? Like, what does that even mean? And, so then after hearing that, and trying to process that, you get referred to the cancer agency. And of course, I went on Facebook and tried to find if there's like a Facebook support group for hairy cell leukemia, and I'm looking up as much about it as I can. But even in the oncologists in BC, they're fantastic. There were limitations to what they had access to, what treatments they could administer. A lot of the support groups have American-based members, and they would say, I was on this one or that one, and these are the kinds that we did. And so you got a bit of an education that way. But I wasn't able to access treatment for another 8 months.
Oh, wow.
After that. And it's not I wouldn't blame the cancer agency or the cancer doctors at all. They found a spot on my lung, and they were worried that it was like latent tuberculosis. And if I got chemo, then I would. And so then I had to get treatment for that for 4 months before we go. And anyways, I was just kind of collecting all of the diseases, it felt like. It's just like, okay, I've got this one and that one and this one. And
go big or go home.
Yeah, right. And so I finally was able. And by the way, this entire time I'm still working in a pandemic. As soon as I received the news, I stopped in person entirely. But I was working on the COVID units. I was seeing patients in my clinic, and so I switched to phone only, which it's no fun. It's nice to see people and to be able to kind of have that interaction because, anyways, that's a side note. In total, I took about a month off during chemo. And that was like the month that I was just completely incapacitated and couldn't work. And I had colleagues that, tried to step in. I had some doctors that tried to come in and fill spaces, but my patients had nowhere to go for most of that. And that weighs heavy.
Mm-hmm.
So good news, in remission, doing great, back to seeing people in person. One of the biggest things I learned from going through cancer treatment was actually about mental health. One of the examples I tell a lot of my patients, I'll say, anxiety. One of the things I tell a lot of my patients is that anxiety is like anxiety. One of the things that I will tell my patients is that depression, anxiety, they're like cancer for your emotions. And I'll ask, what's the worst thing that can happen if you get cancer? And people say, well, you can die. And what's the worst thing that can happen with anxiety and depression? You can die. And I just let that sit for a moment. I, as a side note, lost my father to suicide during that pandemic.
I'm sorry to hear that.
And that's a whole other conversation in terms of gaps in our mental health system. But when I say, look, depression and anxiety is like cancer for your emotions, you think about the compassion that you feel for somebody who has cancer. And do you feel the same compassion for somebody who's struggling with anxiety or depression? Do you feel that compassion for yourself?
I think that's an excellent point, because something like mental health is, it's not the same thing as breaking an arm or a leg, it's not the same as, going in for cancer treatment. So I think so many of us can be really hard on ourselves and not really indulge in that same kind of self-compassion that we would if something else was wrong, something that's easy to point out like cancer. So I think that's a really important point that you've made.
Like, would we ever go to somebody with breast cancer and be like, you just got to stop having breast cancer, just be positive, just wish, you just got to be more like, just think more positively. Like, that would sound just horrifically cruel.
Right.
And I bet you listening to this are hundreds, if not thousands of people who have had someone at some point in their life say, just stop, just think more positively, or just be different. And it's, again, due to that sort of lack of knowledge that this is a real disease. And so, yeah, that's kind of been my experience as a patient. And also my experience as a family member. My father was hospitalized a few weeks prior to his death, and he died the day before he was going to have his first counseling appointment.
Oh my goodness.
As arranged by the hospital. Why did it take 3 weeks? Why would somebody who had already tried, why would it take them 3 weeks?
Do you have any suggestions for some of our listeners that may be dealing with some of these issues about how they can maybe advocate or navigate the system a bit better?
I think one of the things that I would say is that the disease, what it tells you is that you're not worth it, that people would be better without you. And I would just say that isn't true. In terms of navigating the system, it's okay to go to the hospital. It's okay to go to the hospital if you're having a heart attack. It's okay to go to the hospital if you need stitches. And it's okay to go to the hospital if you are going to hurt yourself or worse. That's a completely valid reason. Know that when you're seeking help for your mental health, that there's probably no better investment that you can do in your time or with your money than invest in that. And understand that the system in which we are working, the system in which we are living, it may take a few tries or even a few visits to kind of get through some of those things, and realize that not all physicians have the same pressures, and it can sometimes be discouraging if you don't get the support that you were hoping for. But it doesn't mean that you're not worthy of support. I wish I could spend more time with my patients. And there are those days where you think, this is what I have, this is worth the investment of my time today. But there are many times when I think, I wish I could have just had more time, but my waiting room is full of people and I've got to keep going. And so I try to, and that's again, in the benefit of being a family doctor is that I can say, hey, look, we're going to talk about this today. Let's chat in a few days and kind of reconnect and let's go through and let's have that follow up. And that's not a benefit that's necessarily available to those who don't have a primary care provider. I'm also very lucky because I function in a team-based care environment. I have a wonderful nurse that works in this clinic, and she is able to do some of the psychiatric assessments so that when I go in, that's already done. We have social workers and counselors that are connected to our office so that when somebody comes in and it just feels overwhelming, they've got all of these things and it can be quite heavy. I know that I've got a team that can help me with that. And so I am less hesitant to do that work because I know I'm supported while I do it. But I know that not every physician is in that boat, and it can be quite overwhelming at times.
Right. So it sounds like there are quite a few gaps in the healthcare system for primary care, but especially for mental health. So would you have any suggestions for things that you'd like to see changed in the system to help support those with mental health better?
I mean, from a personal viewpoint, I think if somebody has attempted suicide, they should never have to wait 3 weeks to be seen by a counselor.
Hmm.
But counseling is so valuable. It really needs to be more easily accessible for patients. And that's not really going to happen until the government is able to fund that. Now, to be fair, there is some funding, with the mental health worker that is associated with my clinic. I can send patients and they can get, up to 8 sessions of counseling for free, which is fantastic.
Hmm.
Um, most of us have more than 8 sessions worth of stuff that we got to figure out and sort through. I've been seeing a counselor most of my life, and there's still things that I learn about myself and the way I act and the way I behave and why I do things even now. Um, and I wish everybody could just afford to make that investment. Um, I think the other side of things that we have to realize is that a lot of what we see in mental health stems from trauma, whether that's multi-generational trauma, but often childhood trauma. And we know that a lot of that is experienced because of the social determinants of health. We know that, income inequality just is probably one of the biggest determinants of health. Being able to take that time to care for yourself, not everybody can afford to do that. So we also have to look at the bigger picture of, well, what sort of social safety nets are we going to have for our people so that that child isn't traumatized because they have to sleep in the car or because they can't afford to have all 3 meals that day or because they're witnessing drug use and addiction and all those sorts of things. How can we make life better and encourage them and empower them to realize that they have value and that they can in fact be the last in that chain of intergenerational trauma.
Hmm. I really appreciate how hopeful you are that things will change and things will improve, and that you're part of this advocacy group that is working towards helping to support those changes. For those that are struggling with the healthcare system, would you have some suggestions for them for how to better advocate for themselves or loved ones?
Sure. And kind of like a Dr. J's tips and tricks kind of thing.
Yeah.
Okay. So I think the first thing that I would suggest is know what you're worried about, know what's going on. So if you have XYZ symptoms, write them down. Because at the end of the day, most places are going to say, look, I can't deal with all of these today, so we need to be able to prioritize these things. And it's not because we don't care about the issues, it's just we don't physically have the time to go through every single one. And so, I had one patient that came in, and they're telling me about their toe that they hurt. And I spent 15 minutes, talking about their toe, examining their toe, coming up with a plan of what to do with their toe. And at the end of the visit, as they were leaving, they said, oh, and also I fell by the river the other day and I hit my head and I haven't been able to see out of my right eye.
Oh my goodness.
And I'm like, start with the eye next time, please. I don't care about your toe if you're blind in one eye. Like,
oh my goodness.
And so, I understand, and I don't expect every patient to know, well, is it related? Is it not related? Maybe my toe is related to my eye or whatever. Like, who knows? It could be. But it's important for you to know what's going on so that when you go, it's not just this like, blah, 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 here's all these things. It's okay, I'm going to talk about X, Y, Z. And then again, this is where, you really see that discrepancy in those with family doctors and those without, is that at least with those with the family doctor, they can book that next appointment and they can say, okay, yeah, I'm going to come back. I know that I've got that. Whereas when you go into a walk-in clinic, it's like, okay, well, I hope I can get in again here, because if I don't get in here, then I'm going to have to retell the whole story to someone else and their records aren't shared and they're not going to know what's going on. And it's just like all of those things, right? And so if you know what you're needing, and I would suggest that think about the things that impact your day-to-day the most. So, are there things preventing you from working? Are there things preventing you from having the relationships with your loved ones that you want to have? Are there things that are, causing you suffering? What are they? And then write them down. And if somebody brought a list into me, I don't mind. Like, I'm happy to look at the list and I'll say, okay, what's most important to you? And if they're like, I'm not sure, then I can say, okay, well, let's focus on this. And then we're going to do this. And then we can come up with a plan. It's not ideal. It would be great if somebody could just come in and I could spend an hour with them and we could get through everything. It's just not feasible.
Mm-hmm.
So yeah, that would be my advice for patients, really, is just if you're going to advocate for yourself, make sure you know what your priorities are. And I would also just encourage people, to go in with an open mind. I have no problem with people Googling or doing research. I find that Dr. Google's bedside manner is not great. Everybody's getting cancer and dying basically with that. But I think people forget that the reason they go to the doctor is for their assessment, for their advice, for their encouragement. And, if it's just, well, I want this and I want that and I want this, it's like, okay, like, help me get there. Let me understand why. The vast majority of my patients are, no problems there. And I have some patients that have had, negative interactions with the healthcare system. They go, I come in and, well, I want a full body MRI. Well, why? What's happening? What symptoms are you having? Well, I just want it. Okay, but I need to understand what's happening from a healthcare point of view. And so remember that, doctors aren't just, bureaucrats there to sign off on different papers, that we do want to help and that we do have expertise in terms of what does help and what doesn't.
Right. So it sounds like being sort of organized and intentional, having sort of lists of symptoms, and then also being open-minded to collaborate more with their doctors, or some of the tips that you've offered. Does that sound about right?
Mm-hmm.
Great.
Yeah.
Wonderful. Was there anything else you wanted to add today?
I do want to just, again, speak to the importance of working as a team. To have physicians and nurse practitioners and midwives and massage therapists and mental health workers all being able to sit around the table and help somebody is so valuable. And it frees up patients to be able to see, or it frees up physicians to be able to help more people. With my nurse Judy, I'm able to see more patients a day because she is here and because she is going in and doing so many of the different things. And so she's invaluable. We have some nurse practitioners that I work at with the hospital. Fantastic. It's not a us versus them. It's not a, well, why do pharmacies have prescribing, blah, blah, blah. It's not about us versus them. It's about us together working towards a common goal. And that should be the health of our society.
I really appreciate that, because I think client-centric care is so important, and working as part of multidisciplinary teams really helps to give so many different perspectives on the same problem. And I agree, the more we work together, the more we can share that load, especially with being so short-staffed all over BC.
Yeah.
Great. Well, thank you so much for sharing your in-depth stories and your personal experiences. I think it means a lot to our listeners to hear that, because I think sometimes we forget that that doctors have to experience being patients as well. So
we are
all
humans
in this together,
yes. Yeah,
right?
I didn't get some sort of magical immunity from illness upon graduation from med school.
I'm sure we get a lot more people in med school if we gave those away.
Yeah. No, I appreciate you guys having a chat with me, and I appreciate the work that you do in terms of advocating for the people of BC and getting better access to healthcare, because they're certainly paying for it. So they should be receiving it.
Absolutely. Well, hopefully we can work on that together. Thank you so much for your time.
Take care.
Take care. Remember, together we can advocate for the healthcare that we all need. The content provided on Your Healthcare Matters is for informational purposes only and is not intended as medical advice. Always consult with a qualified healthcare professional regarding any medical concerns. The opinions expressed by guests are their own and do not necessarily reflect the views of the podcast or host.